Nuruddin Bendada has had a very stressful few weeks. Last month, he was diagnosed with a brain tumor, yet still managed to keep things in perspective.
This is the will of God, and He does what He pleases. I know that for every disease, there's medicine.
His sister passed away recently in Algeria. Her lung cancer was discovered too late, so Nuruddin and his brother knew time wasn't on their side. Mohammed is a doctor in the UK and knew exactly what his brother's CT scan results meant.
My heart sunk, and actually he noticed it, but I tried to hide it as much as I could.
Faced with a long waiting list in Algeria, the brothers explored other options.
We searched in neighboring countries like Tunisia. We searched in France. My brother looked in England where he works. But when we found Turkey, we found an excellent choice.
Advancements in healthcare treatments have contributed to Turkey's rising number of medical tourists.
During the 1970s and 80s, many Turkish people went to the US for brain surgeries. Unlike today, there's been a remarkable development in Turkey in the last 20 years, especially in brain surgery.
Turkey receives a lot of medical tourists. Oncology cases are the most common, especially from Iraq and Libya. Cost is a huge factor.
If we compare with the US, Turkey is 10 times cheaper. For example, the cost of brain surgery is roughly $10,000 or $15,000, whereas it costs $100,000 or $120,000 in America.
765,000. That's how many medical tourists came to Turkey last year. That number includes all kinds of transplants, bone marrow, liver, kidney, you name it. But you know what it doesn't include? Hair transplants.
We do not consider really medical tourism or healthcare issues. It's not a healthcare issue, it's an aesthetic issue. I mean, people can survive and can live with hair or without hair.
Amin Çakmak has been promoting Turkish medical tourism in other countries for more than a decade, and it seems to be paying off. He says Turkey will welcome 800,000 medical tourists this year.
Like $7.2 billion with the income. We are now number 3. United States, Germany, and Turkey.
He says Thailand and India receive more patients than Turkey, but their procedures cost less. To reach the #1 spot, Çakmak believes changes need to be made.
The only remain that we have to review our visa regime to make it a little bit easier and controllable, not out of control, controllable, because our council has representative offices in those countries. So we can review this is right patient or real patient or not.
Back in the recovery room, the Bendada brothers are breathing a sigh of relief.
I saw him the first day after the surgery, 2 hours after the surgery, waving at me. That was great.
Now on the road to recovery, the older Bendada can enjoy a second chance at life. Aadel Haleem, Straight Talk.